tear, the principles are the changing portals, viewing and working portals, posterior horn, all inside, end to end using first pass mini or scorpion, usage of passport cannula and several techniques. So I'll just run this video. You can run the video. Video. Play.
You can click there, yes.
So the click. So this
instrument is called as knee scorpion. Similarly, there will be shoulder scorpion, and this red color handle with the needle is a knee scorpion needle. Brown color is a shoulder scorpion needle. So how to use this? This needle, this is a very useful instrument for meniscus repairs. This needle has to be passed like this, and this handle is fixed here. Now this needle is this scorpion instrument is ready for using. Imagine that this is a meniscus with a radial tear. We have to stitch like this. So one end is hooked here. And now when you press this handle, this gets closed. Okay. For example, we are seeing the scope like this. This is the scope, and I am going like this, and I am pressing the handle. When I go near the meniscus, I open. When I go near, I open it like this. I am pulling this. This thread has come out like this. You keep this thread aside, the other end of the thread, other end. So imagine that this is a meniscus. The scorpion needle comes from below to up, and the thread comes from below to up. Other end of the thread, you fix it. This is the thing. Now you have to put the knot outside. Friends.
So with that, so run the video. So this is a radial tear, the posterior horn. So we have to make sure that the needle doesn't damage the cartilage. Whenever we are repairing the radial tears, the one end of the thread is to be held and use the passport cannula to avoid the entanglement of the soft tissues. This is with the scorpion. But whenever you are tightening, there may be overlap or irregularity between the ends when you repair it. So to avoid that, you can avoid tightening initially, later use all inside. So you combination of all inside and scorpion usage for the radial tears of the posterior horn is the best for the lateral meniscus. This is the final picture. Okay, so
If we have to.
Okay, so run the video. So if the radial tear in the anterior part, so anterior part, the oblique radial tear or the parapet tear, you have to you can cut the white zone. Then, as it was discussed, zone specific cannula, inside out needles, and all inside both can be used. And as I was telling, you can switch the portals, working and weaving or weaving to working. So this helps in weaving properly where you have to see. This is all inside first, and then using the curved cannula to fix the inside out needles I have used. So this one all inside, then one inside out needle. So you can also have different configurations like rebar and other techniques to avoid the cut through of the stitches. So then the root of the then we'll come to the root of the lateral meniscus. So root of the medial meniscus is already discussed. The medial meniscus root is the tear of the root due to degenerative cause, whereas lateral meniscus is most of the times it is a traumatic and it is avulsion along with the ACL tear. Commonly it is along with the ACL tear, and you have to check for the lateral meniscus avulsion from the root whenever you are checking. And there are two techniques, transtibial or with a suture anchor. Transtibial technique is the best of that. And so, see, I am going to show one more small, run it. So most important.
So middle of the fiber wire, in the middle, you have to hook it like this.
We have to put the fiber wire in the middle whenever you are using the scorpion for the root.
The root.
So the end of the fiber wire.
Here. We go near the root, open it, go closer. Now the loop is coming. Slowly pull it like this. Keep the two threads outside the joint now. Pull it like this. Here, once again, you fire it, it will come out. Now these two threads, you have to pass it inside this thread.
So the cinch knot, how to put the cinch knot?
Like this.
So run the video. Video. So this is the avulsion of the lateral meniscus. You can see this is with the ACL. So the fiber wire should be in the middle so that the loop is formed. The loop has to be taken through inside so that the cinch knot is formed. And whenever we are doing the lateral meniscus with the ACL, we have to take the cinch knot before and then pass the femoral tunnel and tibial tunnel and reattach the lateral meniscus, then pass the ACL graft. So with the specific jigs, you can use the ACL jig or root jig, which is adjustable for the medial and lateral meniscus. 1 minute, I'll take. So these are the two knots, and then this is the ACL tunnel. Then reattach the meniscus. Then after that, pass the ACL. Next. So exactly similar to that, another one. I'll go. So non-weight bearing for 6 weeks, passive range of movement. A patient can be advanced for knee flexion as tolerated. And thank you for your kind attention.